So what we'll do, we will give you a very brief idea of what is wound. Although all of you are aware, Dr. Eunice is there. Dr. Eunice also can give some thought process is there. You all know about that. What is wound? And secondly, what is the difference between a wound healing and most of these wound care products are primarily to target of the chronic wound. But one more target we should do, that not to make the wound turn to chronic. So we called it wound care management. If you remember, Subir was telling about it's a management, it's an approach. Rati was telling about it's an approach. Now, unfortunately, whoever the company, barring one or two few companies like Smith and Nephew, although they are not very active in India on that wound care part, they are doing all the activities internationally. They started talking about the management. So we need to understand that wound care is not about the products. It about the approach, a holistic approach where there is a multiple involvement of multiple specialties, starting from the primary care physicians to the operating surgeons to the treating nurse as well as the nutritionist. Everybody has to play a significant role along with the caregiver. So it's an approach. Let's talk about wound. Now we in one line, if we see, wound is nothing but a tearing of skin. Whenever there is a skin tearing, there is a wound. Now, when the skin tears, either there is a cut in the skin due to some sharp object, or through some trauma, or the tensile strength of the wound decreases. Now, this point, please remember, it's absolutely important. The tearing of the skin depends on external factors like any trauma, accident, pricking with sharp object, or simply by more pressure on a particular point on the wound, on the skin. Now, if you simultaneously put lot of pinpointed pressure on a specific point of a wound or point of a skin, there will be tearing of skin, which turns into wound. The classic example is that bed sore. If a patient continuously lying on a bed for over a period of time in a supine position or in a laterally, so there are always exerts pressure on certain pressure points on the back. So the tensile strength of the skin reduces and the skin tears, and it started forming the pressure ulcer, which we call breath shoes. Now, if anything, even after such, there are very clear differentiation between two wounds. One is an acute wound and one is a chronic wound. Acute wound is generally a clean wound. If you don't do anything, it will be healed automatically by body's own mechanism within 4 to 6 weeks. Now, what is that minimal needs for this acute wound? You need to close the wound with a sutures or a staplers. If there are foreign particles, foreign substance or sloughs, you clean it with the antiseptics or normal saline. Ideally, we always recommend that skin is the most sensitive part of the body, so we should use the pH balanced soap and water. If you cannot have a pH balanced soap and water, like pH balanced soap is like Johnson and Johnson. If you don't have a pH balanced soap and water, use isotonic, hypotonic solution. Now, hypotonic solution is not always available. Then you use a isotonic solution. What is an isotonic solution? Is nothing but a normal saline, which costs 4 to 5 rupees in India. So the simple understanding, do a cleaning of the wound, do a simple dressings. If you require, put some antimicrobials and the wound will be healed. Now in here, why they use the antimicrobials? This point is very important. Now, they use the antimicrobial to prevent any infection from external microbes. Now, if it happen in a hospital setup, although hospital setup is sterile, but practically there are chances of hospital acquired infection, and which is approximately as high as 65%. So the doctor always use either chlorhexidine or rovidinidine to use as antimicrobials, and then to do up simple dressings. Like Dr. Eunice must be telling us that they are using a simple gauze dressing. They put betadine solutions, put a gauze, swab, and do a dressings. This is a simple treatment of a acute wound. Now, if the wound due to certain condition, like maybe due to infection, due to some comorbidities like diabetes, arterial deficiencies, or venous deficiencies, or some CKDs, a lot of hemoglobin, loss of hemoglobin, a lot of other comorbidities, poor nutrition, the healing process stalled, and the duration exceeds more than 6 weeks, usually months or years, it turns to chronic wound. So when it's a chronic wound, there is a requirement of a comprehensive wound management approach or care. That is we all talk about. So secondly, now what is type of chronic wound? Now acute wound could be anything, uncomplicated burns, like surgical infections, surgical trauma, sutures, normal insect bites, and chronic wound could be like there could be a diabetic ulcers, there could be a venous ulcers, there could be a vascularitis, and this chronic wounds could be a pressure sores, could be a vascular ulcer, could be a diabetic foot ulcer, and along with the diabetic foot ulcer, there could be an element of neuropathy. So these are more complicated ones. Even a simple burn can be turned into a chronic wound. So basically there are 4 stages in a normal wound healing. I'll not go detail. Some of you are already knows about it. Some of you are not known. First process is of course the hemostasis, where there is a tearing of the skin. The platelet comes in contact with the rough surface. There's a depletion of platelet. Then there is a aggression of the platelet, and ultimately they form a thrombus, and the blood get clotted. The next process is basically an inflammatory cell inflammation stage, where there is an entry of the body's own immune carriers like neutrophil and monocyte, and they do a different phagocytosis process, and then lymphocyte infiltration. They control whatever the infections are there. They engulf the foreign parts, and after they heal the wound, then there is a proliferation. In the proliferation stage, there is a formation of new blood vessels. There is a collagen synthesis. There is a formation of extracellular matrix, and re-epithelialization of tissue started. What we call the granulation, the formation of granulation tissues. And the last stage is that's a remodeling stage. There is a formation of mature scar and the complete closure of the wound. So this is in a very brief what is all about the normal acute wound healing process. So I'll show you through some pictures. Now you see this is a process of hemostasis. Now if you see, this is basically a epidermis where there is a cut, the wound. Now the skin has a 3 layers. The upper layer, most layer is epidermis. Then there is a dermis, and then there is a hypodermis. Most of the wound, that is a first degree wound, that restricted itself to epidermis. The second degree goes up to dermis, and in third degree it may also cross hypodermis and go to the bones, which is very difficult. Now, if you see that when there is a cut, the platelets start aggregating, they started coagulating, and they occupy the wound, and the bleeding stops, and there are different processes involved into that. Now, this is a process which we call inflammation. Now, you see this, there are macrophage, there are neutrophils, there are lymphocytes. These three are the barrier of our body. That we call it a WBC. So they release into the wound site, and they through a phagocytosis process, they engulf if there is any foreign substance, that is what we call say the dirty substance due to some trauma, or certain microbes are there. So they engulf this, and they limit the infections. And then there is a entry of this cell called fibroblast, which releases uh, nascent collagen, and that process is known as neocollagenesis. And this collagen started rebuilding the skin along with the formation of angiogenesis. Angiogenesis is basically formation of new blood vessels from the existing blood vessels. So it can supply the important nutrients and oxygen to the newly formed cell. So we need to understand that during a wound, the entire network of blood vessel has been disturbed. So formation of new blood vessels is important to give nutrition to the newly formed cells. Now, see, this is, you see, this is basically a proliferation where this fibroblast cells taking the lead. It started depositing collagen, which is started creating building blocks like epidermal cells. And there is also a formation of vascular growth. If you see in the picture, so in the picture, it is showing a vascular in growth. That is basically newly forming blood vessels. So ultimately, yeah, this is, if you can see this, this is basic. Can you follow my cursor? This is a final stage where you can see there is a remodeling and maturation. The wound has been closed and there is a formation of scar. Please remember the good healing always comes with a good scar. Now you can see this is a picture side by side. What is the difference between an acute wound and chronic wound? The primary difference in chronic wound, the inflammatory stage extended. It cannot be completed and the inflammation stage has not gone into the third stage, that is a proliferation. Now, first, I will introduce you all the symbols that is used in these two pictures. This is absolutely important to understand the entire process. Yeah. On the right side, you can see, first you go to the nomenclature. First, this is a collagen fibroblast. This is a fibroblast cell which provides collagen. Now, just beside the fibroblast cell, there is matrix metalloprotease. Now, this matrix metalloprotease, we say MMP. These are very important for collagen synthesis. These are also very important for angiogenesis. But please remember, they are very important to control the infection. But when there is an increased level of MMPs, it also eat away the newly formed collagen and the cell. Uncontrolled way, it also harms his own body. So the inflammation stage increases. Now, third is a growth factor. You can see the growth factor. Then there is a scab. That is basically the formation of that texture. Then you can see there is a epidermis, which is a forming epidermis. Right? You can see then dermis. Just immediately after epidermis, there are dermis. Epidermis is primarily with a keratocyanotic cell. Then you can see there are blood vessels. You can see there are blood vessels. There are immune cells.
Same color is the blood vessel.
There are bacteria, and this is a fibrin cuff. Fibrin cuff is basically a handcuff. Now, if you see in the acute wound part, what you will see? Everything is normal. There is a normal eschar which has been denoted by A. This is a A. Then there is a healthy growth of keratocyanoid formation. That is a epidermis formation. That is denoted by C. You see there are lot of immune cell like B. There are a lot of growth factors, right? There are very less number of MMP, matrix metalloprotease, which has been denoted by E. There is an excellent angiogenesis. There is an excellent formation of blood vessels. And there are also a lot of fibroblast cells. So this is a normal wound healing process. This is a initial phase. The inflammatory phase is there. This is happening. The process is going on. Inflammation state is excellent. Now it will going to heal. Now see in the other picture where the healing process has been impaired. You see in the scab, in the exture, the color of the exture is grayish yellow, and there are presence of bacteria. This is an infected wound. They already formed a biofilm. Now you can also see that the number of growth factor has been reduced in this picture. There are more number of matrix metalloprotease, the blue one. The level of MMPs increases. What happened when the wound is not healing due to body's own negative feedback mechanism? Body releases more and more MMPs. And you see, the angiogenesis process, that is the formation of blood vessels, has been stopped. C with the F, denoted by F. E is the formation of blood vessel. F is a fibrin cup, is actually stalled the process. And there are very less number of fibroblast cell which actually forms collagen, like D. You see the number of, you can observe the number of immune cell has increased. Simple thing, the enemies are big, body is sending more and more soldiers. But ultimately, they are not able to control it. The moment bacteria forms a biofilm, what is a biofilm? Biofilm is basically a cocoon made of glucose which bacteria creates around it. Once biofilm has been formed, the body cannot recognize the presence of those bacteria. And it is practically impossible for most of the antibiotic to penetrate that layer. So as a result, the bacteria become multi-drug resistant, MDR bacteria, and the wound started become a chronic wound. It does not heal. And it started slowly spreading throughout the body. And ultimately what happened? It leads to amputation. You believe me or not, in every minute, there is one amputation happening in the world due to diabetic foot ulcer.